Hello, folks. This is Sept. I'm a professor at Memorial University of Newfoundland and Labrador, and today I will be talking to you about our work entitled Partnering with Patient Advisors in Designing and Delivering Public Engagement Events on Cancer. So it's a pleasure for me to introduce you to our authors, which are listed here. It's a great collaboration between public members, cancer patient and family members, clinicians, and scientists. And before I move on, I want to say that I have no conflict of interest. So the reason we are making this conversation today is because we designed a virtual public conference on cancer last fall. And as a result, we learned a couple of things and also gained new perspectives and experience. We thought that it could be an interest for you folks or anyone else who would like to partner with patient advisors or organize public engagement activities on cancer. I'm also excited to say that our work, describing this work, is now accepted for publication in Journal of Psychosocial Oncology Research and Practice. So you may want to check this journal to learn more about our work. So to start with, who are we? The Public Interest Group on Cancer Research. This is a very successful patient partnership, patient-scientist partnership in Newfoundland and Labrador. We created in 2021. We currently have 11 cancer-affected individuals, public members, and 4 scientists in the group. The first year, we focus on forming both research and public engagement focused partnership with the group. What does this mean? We wanted to co-design research studies which are most meaningful to these cancer-affected individuals. We also wanted to start organizing public engagement activities on cancer, for example, patient and public education sessions. So the first thing we have done was to organize a public conference on cancer and start sharing knowledge, for example, about cancer support programs, cancer screening programs available to residents, and lived experiences of cancer patients, and so on. So we focus on these 3 themes, again, cancer lived experiences, and we have planned to have 5 talks. 4 of them was delivered by a cancer patient, 1 of them was delivered by a cancer family member. And the other one was, other theme we focused on was the cancer screening, early detection, and cancer support programs available as part of the provincial cancer care program. We had 4 talks regarding these topics, and in the remaining 3 talks during the conference, we focused on importance of working together with public members, patients and families in improving anything from research to implementation of new health services. So these are the 3 conference themes we focused on. And on October 15, 2022, we had this whole day virtual event. It was very successful. We had 174 registrants. This is the schedule. I don't expect you to see the small fonts, but what I want to emphasize here is that we had talks of varying lengths. And importantly, we also had 2 questions and answer sessions, which included speakers and an expert panel, so that the participant could ask questions that they may be interested in. From beginning to end, it was a very successful event, very high energy and well received. But since we want to continue to organize this kind of events that are well taken by the public, we wanted to reflect on our experience, and we wanted to have a better idea about what works well and what needs to be improved for future activities. This can inform, our activities as well as others like yours, future public engagement activities. So we focused on conference satisfaction survey. 52 participants answered the questions. We also received a number of feedback, and we reflected on our experiences as speaker, organizers, and moderators of this event. So all of these things told us that a number of things work very well. For example, our conference objectives were met because almost 100% of the survey respondents say that the sessions were presented in an understandable manner, and they learned something out of the session. So these are really great indicators that our conference objectives in terms of raising awareness about cancer lived experiences, cancer screening and support programs, and so on, were met. We also received other, as I said, feedback through social media, email, in person as well. Even one participant wrote a blog about their experiences and how satisfactory it was. So that's really great indicators. We also identified unplanned positive outcomes. For example, it looks like this event conference actually increased connection between the provincial cancer care program and the local government, which is really a welcome experience. And we also, as a group, experienced a number of positive. For example, we are more confident now in our abilities. We are very satisfied with what we have done. And we also, you know, it was a great skills development exercise for our public members as well as public speakers, as organizers, and so on. So in so many ways, a lot of things worked in this conference. On the other side of the coin, there were a number of things to be improved as well, and the key ones are shown here. In terms of technology, virtual conferences are great, but we really need to make it available to wider population. For example, make a lot more people being aware of this event could increase the participation rates. And we also need to make the registration process and technical requirements really easier for participation to increase. And some individuals also require conference recording materials, for example, slide decks, etc., so that they can reflect on the talks a little bit more. So these are some of the key points that we would like to improve in the future activities. There are other things that needs to be considered as well. For example, the emotional impact of speaking for cancer patients or family members in a public event like this. So in one way, in one case, we were able to mitigate this through pre-recording a talk, but in the future, we will absolutely work together with the patient speakers and find these or other ways that are most suitable for them. And when we reflected upon our experience, it gets really personal. One speaker said, you know, they were really, it was an emotionally draining experience for them, but they would do it again and again because they do see a value in speaking their lived experiences and helping others going through the same journey. So it's really, I really applaud the courage and dedication of this patient speaker. I'm very grateful. And on the other hand, some of us, including myself, felt very, very excited about the success of this event, but also felt guilty because if I was able to disseminate this kind of useful knowledge about cancer to my family members and friends, maybe some of them would not suffer so much because of cancer. So it's really interesting that we can feel this way, but that's what it is. So at a personal level as well, we had to reflect a lot out of after this conference. It's good. So in conclusion, we had a very successful public conference on cancer in Newfoundland and Labrador, and I think that the reason that we partnered with patient partners was the most important determinants of success of this conference. The feedbacks that we received was incredible, and we will work on those to improve and do much better. As a matter of fact, we are working on currently a public outreach strategy on cancer in Newfoundland and Labrador, and we are very much utilizing this and other feedback in our strategy. So with this, I want to thank everyone, particularly our patient partners and other members of the Public Interest Group on Cancer Research and founders and supporters, and thank you for listening. This is all I can say for today, but don't hesitate to contact me if you need to. I can contact us savas@man.ca. Thank you very much.